Hi everyone, I'm Silda. I am an assistant lecturer at Faculty of Public Health, University of Vlora, Ismail, Qemali. I have conducted a transversal study on the Albanian population. The main purpose of this study is to evaluate the distribution, types, and high skin manifestations of COVID-19. Finding the potential link between COVID-19 and cutaneous manifestation may help to understand the best policies in disease control. We are seeing increasing number of cases of COVID-19 patients presenting with heterogeneous presentations. Here in Albania, there are more and more COVID-19 patients with skin manifestations. I want to talk to you about some of the findings that have been seen here in Albania in our COVID-19 patients. These lesions manifest at various times in relation to COVID-19 symptoms, which may indicate whether the lesions are virus-induced, medicine-induced, or are delayed immunological responses to the infection. So, in thinking about the cutaneous manifestations of COVID-19, I really like to think of it in two main categories. The first are rashes that are related to it being a viral process. So these are rashes that present with the classic viral exanthems, classic maculopapular eruptions. In these patients, these rashes can start at the onset of symptoms, but can also trail behind. These rashes can be seen also at the hospitalized patients. These patients are going to present with widespread pink macules and papules that can be clustered together and can involve the trunk, the extremities, or can be widespread. Most of the patients have reported to have itching. There are some other patients that have reported to have widespread blisters. The main challenge in diagnosing these patients is that an exanthematous drug reaction is a very similar presentation and the main differential diagnosis that we have to consider. These patients will present with the same skin findings of that widespread maculopapular rash, but typically is going to occur 1 to 2 weeks after the induction of the medication. So, an exanthematous drug reaction should only occur after a latency period of 1 to 2 weeks if the patient has never previously been exposed to the medication. So, when we are treating a COVID-19 patient, if they present with a widespread rash after you've started a new treatment and it's their first time being exposed to that medication, if it's a really short period between medication initiation and the development of the rash, it's likely related to the underlying COVID-19. And the second type of rash are rashes related to vascular insufficiency. This means that there is not enough skin perfusion because of macro or microthrombosis. Clinically, these patients have been reported to have livedo reticularis, which are net-like patches on the extremities. You can also see findings of perniosis, which are purple macules and patches on the tips of the digits, mimicking frostbite. These skin manifestations have been seen in patients that have mild and moderate disease. Thank you, and I hope everyone stays safe.